Hi, welcome to Module 2. During Module 2, you will have various assigned readings. You will continue to read from The Heart and Soul of Change. As you recall, previous module, you read about the 4 common factors. To review, the 4 common factors are four variables that have been found to really influence treatment outcome. The first one being client factors. What is it that the client brings into the therapy that increases their chance of a positive outcome? The next one is the client-therapist relationship and how that affects treatment outcome as well. The third one being expectancy or hopes of the client, and the last one, the actual techniques that the therapist uses to increase positive treatment. You'll continue to read about these 4 common factors, but during this module 2, chapter 4, you will actually focus strictly on client factors. You will read about the client as self-healer. The book does a tremendous job of doing and following up some of the research that has been done out there on what are the variables within the client, what are the factors outside of the client that influence treatment. Then in chapter 5, you will look specifically at the client-therapist relationship. And again, it'll go in depth into the research that supports those studies and that show that client-therapist relationship has a tremendous effect on treatment outcome. You will also be reading about 2 cases. The first case you will be reading about in your case of psychotherapy book is a case about Mary. And this approach that you'll read in chapter 1 is a psychoanalytic approach. And you'll be looking at a client, Mary, who has a family history, who has a trauma history, and she presents to therapy with her 5.5-month infant. Mary has a history of abuse and has not been able to nurture her infant the way she would like to be able to mother. She would like to mother differently than she was mothered. But of course, as she begins to parent, a lot of things from her past start to come up. And as you will see in this case example, as you will read in the psychoanalytic approach, what you'll see is that the therapist uses a lot of Mary's past to try to bring up these feelings and have a corrective experience. I think one of the unique things about case 1 is that the therapist actually does the therapy in the client's home where the infant is, and the therapist is able to look at the relationship between the mother and the infant and to slowly see how Mary improves in her mothering skills. There's also a father in the picture. Mary is married to a man, but it is not ever determinative if the man in the picture is actually the paternal or biological father of the infant, yet he is determined to also parent this child in a way that he wasn't parent, as he also presents with a history of trauma. You will see in this case various different approaches that are considered psychoanalytic. They talk about something called transference. In this case, Mary is unable to sit with a therapist who is a male. And one of the reasons she can't sit in a room with a male is because of her sexual trauma history, in case she was sexually abused by a cousin. And so therefore her anxiety when she's sitting with a male therapist is too much for her to stand. So I want you to look at all the different approaches that are psychoanalytic. But as you read this case, what I want you to focus on is not only the techniques, but I want you to focus on Mary's relationship with the therapist. I want you to look at what Mary brings to the session, what support Mary has outside of her immediate family to help her have a positive outcome, how the clinic itself supports her, and also to look at how much expectancy, how much hope does Mary have for change. So how do you incorporate these 4 common factors into this one case while also looking at the psychoanalytic techniques used? The next case you'll be reading about is in chapter 11, uses a systems approach. As you recall, you will be using a systems approach in your paper when you discuss the case that will be presented during the module. the systems approach is very complex, and as you read through this chapter, I want you to really focus on all the different and various components that are in the treatment room when you have every family member, when the dynamics of the family members are all in the room. The systems approach that you will be reading about also uses a consultation approach in which the therapist is in the room with the family while a group of consultants sit outside looking at the session through a two-way mirror. And at various points throughout the session, the therapist walks out and consults with the team and then comes back and gives the recommendations by the team. This is something that sometimes is used in systems approach. I also want you to look at the different dynamics that are in the room when the father and mother are in. We're talking about a case in which Rachel is a 23-year-old girl with anorexic, and she is trying to move out of the house, but she feels responsible for her parents' marriage and feels that if she was to leave the house, their marriage would break apart. And so I really want you to look at all the various dynamics, the paradoxical techniques that the therapist uses in which she continues to bring up Rachel's negative feelings to only make Rachel realize how absurd to some degree her thoughts are. Look at the sisters in therapy. Look at the mother-father relationship. Look at how Rachel interacts with all of her family. Look at the way the therapist deals with all the family members and the thought process that goes into a systems approach. As you look at the systems approach and as you look at Rachel and her family, I again want you to look at what is, in this case, the relationship between Rachel and the family members and the therapist. It's a very interesting relationship that develops. Also to look at what is it that the family brings into the session and how does that increase their positive outcome. And to look at Rachel, how motivated is she to move out of her house and to stay away from her house and to gain some weight and control of her own life. I want you to look at both of these cases and imagine yourself being the therapist in these cases, whether you're using the psychoanalytic approach or the systems approach. I want you to imagine sitting in both of these cases and imagine what are the issues that would come up for you. What are some of the things that you would do differently that both of these therapists have done? And what would you bring to those therapy sessions, those cases that were not presented in your book? So I hope that you will enjoy Module 2 as we get further into the 4 common factors and as you start to read about individual cases that represent the different counseling techniques that we will be talking about. Thank you very much and enjoy Module 2.